What a beautiful time of year. It's beginning to be sunny outside and really beautiful weather as well, temperature-wise. But it's also that time of year where you're probably starting to suffer from allergies if you're an allergy sufferer. And so we're going to talk about that today, what to do, especially if you also have a newborn or an infant who is beginning to sneeze and you're wondering if they have allergies. Could that be allergies? Well, we're going to answer that on today's video. This is Dr. Obidi, pediatrician at Partners in Pediatrics and Family Health and CEO of Newborn Prep Academy, where we create content to help parents parent their newborns more confidently. So, first of all, let's answer that question. If you have a newborn or a baby in their infant in the first year of life who is beginning to sneeze, could those be allergies? Most likely not. Most kids don't develop allergies until they're 2-3 years of age, and usually even older than that, closer to 10 years of age. In the older childhood years, that's when most of those will happen, because typically they will have to be exposed over a number of seasons to the allergen to develop a reaction to that allergen, where they're producing histamine, which is a kind of protein that triggers all those allergy symptoms that we are used to when it comes to allergies, like sneezing and nasal congestion and all the sinus pressure and all of those drainage down your throat, a cough, itchy eyes. Those usually are caused by histamine reactions in the body. But again, your body needs to be primed by being exposed to that allergen over a period of time. However, sometimes you can have infants or very young toddlers develop allergies, and most times those are going to be to indoor allergens like molds or dust mites, things along this nature. And of course, food allergies can develop much earlier as well. So if you have a newborn who's sneezing, it's probably just to clear their nasal passages. Most newborns are obligatory nose breathers, which means they can only breathe through their nose initially. And so anything that irritates the nose will make them sneeze, so they can clear their passages out and breathe much easier. So that will answer that question. Now, what do you do if you have allergies this time of year and you're beginning to have really uncomfortable symptoms? Well, one is, first of all, just make sure that you're making some efforts to control your environment and reducing your environmental exposure to the allergens that may be around you. And those could be simple things like, if you have carpets, that you're vacuuming those frequently. If you have blinds, that you're vacuuming and cleaning those or laundering those frequently where you're able to. That you're keeping your windows and doors closed this time of year, especially when the pollen counts are high. If you have gone outdoors, when you come back indoors, especially in the evenings before you retire for the evening, that you're having a bath or using a wet washcloth to sort of wipe off pollen off your face, your eyebrows, eyelashes, the hair. These are simple things you can do to control indoor allergies. You're keeping the humidity in the house low, on the lower side, so you can control mold allergens, which are typically indoor allergens. One of the major indoor allergens you can have. If you have potted plants, you're either getting rid of those, or again keeping the humidity down in the home. Again, those are simple things you can do. So that will be the first place to start, is trying to take care of that. Now, if you are having significant symptoms, you're sneezing, itchy eyes, itchy nose, drainage down your throat, a dry cough, just really having an uncomfortable time, there are some over-the-counter preparations you can use. Even just saline preparations will go a long way to providing some relief. You have antihistamines that you can use for your older kids and adults. However, you can make an appointment to come into the office where we can customize a treatment for your allergies. Make sure that you're maximally controlled with the right combination of medications where that is appropriate to help control your symptoms. And for some of our allergy sufferers, especially if this has gone on season in and season out, and you're not having really great control with your allergy medications, or it's difficult to take the medications, or you're having side effects from the medications, you can always consider immunotherapy as well, which will be allergy shots. And we do allergy testing and allergy shots or immunotherapy here at the office, and we'll be happy to evaluate you to see if you're a great candidate for that treatment, which really addresses the root of the problem and desensitizes you to whatever allergens are causing your symptoms. All right, well, I thought I'll come out on this beautiful day just to let you know that there's much you can do for your allergies. And so feel free to call, make an appointment. That's the number there, 301-791-7060. We'll be happy to see you here at the office and see how we can customize a plan to take care of your allergies. All right, you take care now. Bye.